Hey man, you ready to roll?
Yeah, dude, I just gotta take my CBD first. This stuff's so goddamn expensive. I wish my benefits covered it.
Hey, actually, I know a guy who's pushing for that.
For real?
Okay, welcome to Second Story, everyone. Thanks for joining us. I'm Corey Leckie. That guy that's always there with me is Josh Zabalski, and joining us today is Dr. Blake Pearson. Thanks for coming on.
Thanks for having me.
All right, so Blake, you began as a family physician. You've since moved into kind of a more holistic approach to medicine, mainly in the field of cannabinoids, which you use to treat all types of ailments, right? Chronic pain and mental health and sleep disorders, dementia. Why don't you tell us a little bit about that and what made you turn towards this type of medicine?
Sure. So I originally got my start as a family physician and did that for a few years and really started using the cannabinoid based medicines in my own patient population. So just like you mentioned, Corey, chronic pain, we had a lot of seniors. So that's really how it began. And then once I started to see the benefits in some of these patients and being able to get them off things like opioids or some sleep medications like lorazepam or the benzodiazepines, medications that we're moving away from due to the harms, I thought to myself, okay, this seems very beneficial, minimal side effects. And then I really did a deep dive into the science and different conferences and really educated myself. Ultimately, to start my own cannabinoid practice. And just as you mentioned, it's expanded now from chronic pain to sleep disorders, which are certainly the most common referrals, but to things like dementia, agitation with dementia, and even into children with autism, severe autism that self-harm. We use cannabinoids to help reduce some of those behaviors.
Like, obviously, you're still dealing with families, you're still dealing with all the same types of patients you were before, but what made you turn towards that specifically?
Really, it was the impact that it had and how it could change someone's life. So certainly we need primary care physicians and they do a great job. But for me, it was, I didn't feel I was having that impact that I could have. Like when you can improve someone's life by, for example, the essential tremor patients where they can't hold a cup of coffee or they can't eat, and then they can because you steady their tremor out with something like CBD. You really, patient feels good, you feel good. And it was really just that. I was having a harder time monitoring things like cholesterol and some of these things where you really wanted the patient to take ownership. And I was getting much more into exercise, nutrition as a means to avoid these things. So it was kind of a mix of more of a holistic train of thought for chronic disease. And then also on the cannabinoid side, seeing some of these very interesting cases and having these great results that made me switch.
I have my own biases when it comes to medicine. I do take CBD for chronic pain, so I am somebody who's benefited from it. I was very apprehensive at first about taking it. So to give the full story, I have had a back issue since I was probably 18, so going on 20 years. Currently, I'm waiting on double hip surgery, and I have been for many, many years. Our lovely healthcare system is super expedient, so I should be in there in the next couple of years, I hope. But when people started talking to me about CBD and taking it for inflammation and chronic pain and things like that, I was like, really? Like, is that something that's actually going to help me? So I kind of took it begrudgingly, and it worked. And I've been using it for almost 2 years, and it's kept me out of the hospital essentially. But so going back to my state of mind, I think the way I felt is probably pretty common, like in how people actually feel about using things like CBD, THC, cannabis, all those. How do you overcome that with patients? People who come in who are like, I don't think this will work for me.
Yeah, it's a very common scenario, that's for sure. And not just with patients, Josh, but even for other physicians and healthcare practitioners. So the truth is there was basically kind of this false narrative where it's like CBD and THC are great for everything and they'll fix any of your ailments. And that's really what causes, of course, a lot of physicians and patients to be skeptical. But to your point on the results, for certain conditions, yeah, there is benefit. And it's because of CBD and THC. They both have anti-inflammatory properties. So that narrative is true. There's good bench science to support that they modulate the immune system to reduce inflammation. So you kind of get over that stigma, if you will, with education and the results. So I guess to summarize, it really can help, but it doesn't help everything. And it's important to be specific with the condition and be honest with the patients about it.
So I find it funny you bring up talking about physicians. Every time not every time, I shouldn't speak in absolutes, but most of the time when I'm talking to a doctor and I tell them that I only take CBD, so they ask about medication, they're always shocked because they'll look at my MRIs or my CAT scans and the level of, discomfort I should be in. And then they're like, so what medications are you on? I just tell them CBD and they're always like, really? That's it? Like, yeah, that's it. That and exercise and, not eating inflammatory foods. And that's pretty much what takes care of it. Do you think, going back in a little bit of history about like cannabis and stuff like that, when we grew up, Corey's a little bit older than me, a lot older than me.
Easy.
Yeah, not that much older. There was so much like propaganda and dogma against cannabis from when I was a kid, like the whole Reagan era of the 80s, like just say no. And, that whole thing that I still think so many people carry that today when they hear cannabis. And you just look at how long it took to get legalized. How much do you think that plays into it? Just history and sort of what we've been brought up with.
Huge. And still, even though it's legalized, still tons of stigma. So cannabis got a real raw deal because not only is there the stigma, but with that, there was the inability to do research on CBD and THC. And a lot of the funded research, 60s, 70s, 80s by NIDA in the US was only through the lens of harms. So you have this big list of studies that was clearly focused on harms without having any of the research on the benefits. Now, the good thing with legalization, with things changing in the US, believe it or not, it was Schedule 1 up until, it still is, but Congress just passed to change it to Schedule 3. And what that means, Schedule 1 was there was no medicinal value, you couldn't do research, it was akin to heroin and cocaine, just absurd. So the good news is now that we can research it, you're seeing a lot of the studies that supported what a lot of patients were saying in the past. So stigma's still a thing, but with education and more of these studies coming out, it is starting to lessen.
If people are history buffs and you look back on the history on how they actually made marijuana illegal, especially in the States, it's pretty wild to read. A lot of it was just lobbying, particularly like plastics manufacturers wanted it to be illegal. I think newspaper manufacturers as well.
Very racist too. A lot of racial undertones.
Yeah, I was going to bring up Nixon in the 70s. Like, his voter base was not African Americans, and he was more than happy to throw them all in prison so that they couldn't vote. So that was a great way to do it. Also, the pharmaceutical industry wasn't a huge fan of it as well. So you had all those components, and it led to a very large lobby against having legalized cannabis.
Yeah. And on the pharmaceutical industry too, they're putting up a lot of barriers because it really is a game changer in that, we have patients that can come off a sleep medication. So like a Ambien or lorazepam or Zopiclone, they can potentially come off a Lyrica or a gabapentin, so a pain medication. Now they're sleeping better, their pain's better managed, so they come off of their antidepressant. So it really is disruptive in that it can reduce polypharmacy or the number of medications someone's on, which of course affects the bottom line for those pharmaceutical companies. And the other thing too that is getting in the way of progress is you can't patent CBD or THC. So a big knock on physicians adopting this is there isn't enough evidence, or their large randomized control trial, which costs millions of dollars, because nobody can patent it, claim it as their own, of course, monetize that. So you'll see in cannabinoid science, great studies, but they only have 40 participants, 50 participants, because they're funded by universities or private companies. And that's where you don't see the physician adoption because the study's too small. But it's this reciprocal kind of process that if you just take a step back and kind of have a common sense view, it does make sense. But that's often an argument from a lot of the folks on the medicine side.
So yeah, Pfizer's not going to get involved in the whole thing, right?
So
Is that kind of the idea?
That's kind of the idea. They won't support, let's say, a whole plant extract because can't patent that. But what they are getting involved with, and they have bought a cannabinoid science company, is like isolates, or really isolating or making a new cannabinoid molecule that basically is the same as CBD or THC, with just a small change to the side chain or something like that to make it unique. So there's big money being spent on that side of things. And the first medication to kind of hit the stage and make a pharmaceutical company a lot of money, Epidiolex, is an example of that. So that's pharma CBD that went through the testing, and GW Pharma, who developed it, sold it to Jazz Pharmaceuticals for like $5 or $6 billion, something crazy like that.
Man,
it's a nice payday.
Yeah, yeah. So it is developing, but it's very specific pharmaceutical isolates, which generally, when you do that, doses have to be higher, side effects are more, because when you can use the whole plant with the array of cannabinoids, the minor cannabinoids, the terpenes, you have more of an effect with smaller doses, and they're better tolerated. But when you use these isolates, it's higher doses and usually more side effects.
Interesting. Corey, do you have a question? I got another one if you don't.
No, hit him up.
All right.
Yeah.
I feel like you're just sitting there like an idiot.
Yeah. No, I assume that this would be a big conversation between the two of you, because I know Josh's situation with healthcare and all the waiting around you've done, all the opiate pushing that's happened to you, like, and then Blake, I know your side, you've been sort of fighting for things like coverage and opiate reduction and things like that. So
yeah. Well, on that note too, on the opiate side and coverage, it's mind blowing that, Josh, for instance, if you were on disability, I could start you on an opioid for your pain, and it would be covered. And I would actually have to, because it's covered. You don't want to pay out of pocket for your CBD. And we have so many folks on disability who do want to switch, or they want to lower their opioid doses, but they simply can't even start because they have to buy the CBD out of pocket. So they're forced, because there's not a lot of money to folks on disability monthly. They're forced to stay on their opioid because they need to buy their groceries, they need to pay their rent, and it's a massive injustice in the country.
For sure. So you just described my story almost to the letter. So when I got out of the hospital, I was in the hospital for 6 weeks, couldn't walk, got out of the hospital, still could barely walk. And I was prescribed hydromorphone, Celebrex, Lyrica, and one other medication that I forget what it was. But anyways, the hydromorphone was pretty terrifying, especially when I was in the hospital. I was on such a high dose that I was sleeping between 20 and 22 hours a day. And my wife was basically like, this thing's getting it's hooks into you. You need to get off of it. So I just started to slowly lower the dose, but my pain increased. And then when I got out of the hospital, I had all this free medication that my benefits were covering. And then people were recommending CBD. And I went to a store and I was like, it's like going to be $40 every 2 weeks to use this stuff. But I did it because I was fortunate enough that I could afford it. But it would have been a lot easier decision to make if I wasn't out of pocket, $80 a month at that time. I'm on a lower dose now, so it's not as expensive, but at first, like $80 a month to somebody on disability would be, you're talking about maybe 10% of their income.
Yeah.
Which is, astronomical.
And guess what? For those folks in your situation, they get started on an opioid for a medical indication, but 80% of the folks who go on to abuse heroin got started with that first prescription. And we all know how crazy the opioid crisis is here in Canada and in the US. And to me, it always made sense. Why don't we avoid the first prescription? And so certainly CBD can do that. But again, if there's no coverage, it creates this situation that just doesn't make any sense.
Yeah. I talked to a gentleman for my first book, just briefly when I was writing my first book, who was a football player who blew out his knee when he was in college. He was a college football player, blew out his knee, tore his ACL, had to have surgery. They put him on OxyContin. He got hooked on it. And after they took him off of it, he actually went and broke his own foot so that he could get more. So he beat his own foot in so bad that they gave him more pills. And it spiraled from there, and eventually he ended up robbing an armored car to fund his drug habit, and he got caught, and he's clean now. But a pretty wild story to just go from I need knee surgery to now I'm robbing an armored car because I need drug money.
Wow.
And that's not really that unique of a story either.
No, exactly.
Yeah, and Blake, speaking of opioids, didn't you have some role in research with the Lin?
Yeah. So prior to COVID, I was part of the opioid reduction strategy, and our take on that was because physicians didn't have any baseline knowledge on the endocannabinoid system, nor feel comfortable in prescribing cannabinoids as a result. That strategy involved, I went around to the different family health teams and educated the physicians in the endocannabinoid system, and then how to use CBD and THC in practice. And the thought there was part of the strategy of reduction. Again, if we can avoid that first prescription, then that's certainly a tool in the toolbox. And we did have good success. We saw a lot of the family health teams, they measure things like this, mean morphine equivalents. That's how they measure their opioid stats. And as expected, and I was pleased to see this, as we did that, we saw the numbers come down. But the only disappointing thing with that role was as soon as COVID hit, that's when they decided to cut the project and the funding, and we weren't able to expand upon that work.
Unreal.
Yeah, that's crazy.
Yeah.
People didn't have any mental health issues during the pandemic, right?
Right.
That was not an issue.
Yes, that's why it was ass backwards on that decision. Like we should have ramped up because of what we saw, and of course, hindsight's 2020. But certainly, there was no slowing down with the opioid stats, and in fact, we saw them ramp up. So I'm hopeful someday we can continue that work because we did lay a lot of good groundwork, and it just needs to get rebooted.
Hindsight's 2020. That's a good slogan for the pandemic.
Right.
Yeah.
Touche.
That's a pretty good one. Yeah, it's not bad.
Let's make
Speaking
some shirts.
of, yeah, that is actually a pretty good shirt. We should market that one.
This episode is brought to you by Bad Workwear North America. Bad is a fashion-forward workwear brand from Australia with a wide selection of workwear for men and women that is not only durable and functional, but stylish and modern as well. With items like slim-fit work pants, waterproof hoodies, and a robust women's lineup, you're sure to find something you'll love. They offer free returns and exchanges on all orders, and listeners of this show, you can use the code SECONDSTORY at checkout to get 10% off your first order at badnorthamerica.com. Once again, use the code SECONDSTORY at badnorthamerica.com and treat yourself to some new gear.
So I'll tell you my story when I was in the hospital. So I mentioned earlier, 6 weeks in the hospital, couldn't walk. I actually was on an orthopedic unit of a hospital. Had a surgeon. It appeared like I was going to have some type of a surgery, but they were just trying to figure out what was actually wrong with me. About 3 weeks into my stay, I became very frustrated because I kept telling them I feel like I have a hip issue, and they just kept looking at my back because I had a herniated disc, which I mean kind of makes sense. It was the most obvious thing that presented itself. My surgeon, though, I never met the person. And at one point, I actually said, "When am I going to meet this guy?" And they're like, "Actually, your surgeon is a female." I was like, "There you go." Like, I didn't even know that. And this is supposed to be the person who's going to, cut me open and operate on me, which it never ended up happening. But I was there 4 weeks, never met the surgeon. They just shipped me off to another hospital. That was it. But that's pretty wild to go through something that's that big of a deal, and you never actually meet the person just because they were so overworked. Like, I don't really fault the doctor. I fault the system that doctor has to work in, which is just terrible. But I want to touch on one other thing that you said. I'd actually written this quote down earlier, and I was going to ask you about it if it was true, but I think you kind of just proved that it is. One of the residents that was there at one point said to me about Western medicine, they said, the problem with Western medicine is that it's completely reactionary instead of actionary. He's like, so we wait till somebody's morbidly obese, and then they come in and we say, hey, we're going to try to fix you now, versus like stopping that person 5, 10, 15 years beforehand and being like, hey, your diet is terrible. You don't exercise. You should probably do those baseline things so that you don't end up in here with diabetes, that kind of thing.
Yeah.
So obviously that's true.
Oh, it is very true. And it's the biggest thing in healthcare at the moment is if we can shift to that prevention mode, again, strain on the system, costs, that is where it's at. That's where everything needs to be focused. Peter Attia, who's a great follow and just wrote a great book on longevity and living well, really highlights that. And he phrases it as medicine 2.0 is where we were at with, oh, you're obese, let's act now. Now you have that blockage in your coronary artery, let's fix it now. You have diabetes, now it's time to treat you because you've reached this level. This is when we intervene. And it is so much more advantageous to start well before these processes even develop. And we can, but we're talking 10, 20 years before is when we need to. So that resident was right. Then there's a big push amongst small amounts of individuals within medicine to really shift to that model. And again, that comes back to educating that in med school. That comes back to educating doctors on that now and informing patients, because patients don't know that. And I think if everybody had a little bit more education on that, people would be more proactive to make the choices in the 20s and 30s, as opposed to getting the stent when you're 60 or going on insulin when you're 60. It can be avoided. It just happens to happen. It has to happen much, much earlier.
I already know the answer to this question, but I'm going to ask it anyways, just so that you can answer it in a much more educated fashion. Why is there only a minority of people pushing that? Why don't the majority of, like you say, doctors, people push that, hey, in your 20s, in your 30s, be healthy, exercise, eat right, all that stuff? Why does that push not exist yet?
I don't know. I do know that it's not in the curriculum. So, for the physicians that go to med school, it is simply just not discussed. Want to talk nutrition? There isn't really any class. Maybe there's a half an hour talk in second year or something like that. But a lot of these preventative ideas and approaches simply aren't taught in med school. And it took me just being curious, and obviously being curious about a lot of things, to dive into some of these areas.
What do you think the answer is, Josh?
What do I think the answer is? I think there's enough of a powerful lobby that pushes to not have that happen, whether it's pharmaceutical companies,
it's not profitable.
Food manufacturers.
Yeah,
exactly. Like if you're manufacturing potato chips, it's not in your interest to be telling people in their 20s, hey, maybe you shouldn't eat that. Maybe you should eat apples instead. And I think the most powerful lobbies are not like your local, produce operator who's got to stand at the market, who's selling apples and carrots and all that healthy stuff. It's the big, fast food companies, the big, snack manufacturers, the big, soft drink manufacturers, they have a lot of power and a lot of influence. And I think they really exhibit that.
They do. And it's certainly not even like conspiracy theory talk. It is true. And even I was following a guy yesterday. He went to Stanford Medical School to see the grounds. And right as soon as you walk in, this Institute of Health, Coca-Cola machine, the vending machine has all the chips and chocolate bars. And so they do have a lot of influence. And in the US, where they're on the folks that are on food stamps and things like that, the lobbyists have control over that. Folks can, instead of choosing the healthy option, they often go, they can use their allotments to get Coke, chips, and it's this cycle where that's the money that's given by the government, and people then are spending it on these harmful foods. So there's a big push over there as well to start regulating that and kind of having a stream for healthier options for people who need it.
And it's almost become a bit of a third rail too, telling people to be healthy. Just if you remember, I think it was 2021, Joe Rogan said, my advice to young people would be to exercise and eat healthy. And that was it. And people like freaked out about that. They're like, he's not a doctor and all this kind of stuff. And it's like, all he's telling you is to just maybe eat right and, get up off your couch. And like, that was somehow a controversial statement, which is just nuts.
Yeah. And exercise, if we could make it a pill, blockbuster pill, because lowered cardiovascular risk rates, right? We're learning dementia rates for the people that exercise or do weight-bearing exercise are lower. Like almost every one of these chronic conditions, obesity, diabetes, Alzheimer's, dementia, can be reduced with exercise. So it's no BS, and we'll continue to kind of to shout it out there.
I think it's really cool too, the way that you talk about the way that you showcase your own journey, Blake. Like you're always putting up the walks that you do, the nature walks, you're getting up in the morning, you're going out paddleboarding, all these things that it really showcases to your patients and your followers and everything that right there is probably more important than any medication out there, right?
Yeah. And thank you for saying that, because that really was kind of the intention with the social platforms, was to highlight that, because who am I to say, do these things if I'm not walking the walk as well? So I'm really trying to use the social media channels to walk the walk, to kind of show examples of what these activities are. And I'm even trying to use it as to keep myself on track, because if I can, it's almost kind of using social media to my advantage, rather it running my show and me always checking. I'm trying to use it to help me. So if I have to go for that run or paddleboard to post, like it's kind of a neat way to keep me accountable in my own health.
Yeah. Like I've walked into that doctor's office where he's 65 pounds overweight and telling me, be careful, you could become pre-diabetic. Like
yeah. It's like what?
Doc, are you the right person to be telling me this?
And speaking of pre-diabetes, I just saw a physician I follow in the US, and she's eliminated her pre-diabetes by continuous glucose monitoring. So these new state-of-the-art tools, again, so what that is it monitors your glucose continuously, as you would expect with that name. But that's where you put it on your arm, you can see it on your phone, your glucose levels, and it's another example of knowledge is power and a natural solution, because once you're aware of your glucose levels and how sleep affects it, or what food does this, you can really control that. So she was able to, just by monitoring her glucose levels, paying attention, now she's out of pre-diabetes. So it's really cool, some of the new tech that can help you put your health in your own hands as well.
Do you think that we've talked a lot about social media on this show being sort of toxic, but one thing that I actually think social media is having a positive effect on is it's making a lot of people a lot more aware of their own health. I think this is true anyway. I may be wrong, but at least in my circles, I've noticed that people they tend to follow, nutritionists. They tend to follow people who talk a lot about exercise. Do you think that we're kind of turning a corner when it comes to that because of maybe social media is playing a part in it?
I hope so. I think that's true, certainly in my circles as well. And it's all, of course, linked to the right follow too, because there's like a lot of people putting a lot of health info out there that maybe shouldn't be. So I'm with you. As long as it's good quality, then it's a wonderful tool for health. And the thing with social media is like when you consume with purpose like that, 100% super valuable. Where people get into the issues, of course, is kind of opening it and just openly scrolling and like whatever pops up they're consuming. And that's kind of where that negative side or the downside is. And you 2 hours later, it's like, what was I even doing? So I do think it's a great tool when used wisely. And just personally, that's one of the things I've been trying to do is set the timers or have the app that like locks you out. You can't go in it after 6, or set your notifications to sleep mode. And when you do that, it can be really used as a tool. And actually, I'd like to see this being taught in schools. The kids these days, they don't do that. They aren't aware of that, or how it's not being stressed how to understand it. And I think that would be useful curriculum for the kiddos to have kind of an understanding of how this social media algorithm works and why they should, put some limitations on it.
Yeah. Otherwise, you're just sitting on the couch watching 20 YouTube videos on why you should go out for a walk. Yeah. And it's like, damn, I should have just gone out for a walk.
Yeah. You could have listened to it too while you were out for your walk. You could have just listened on a podcast or something like that.
Exactly. Here's how to walk. Here's how to walk properly. Like, damn,
one foot in front of the other. Yeah.
Should have just went out and walked.
Yeah, absolutely. I've seen those. You talk a lot on your website about progressive medicine. I'm curious, what does that mean to you, the term progressive medicine?
To me, it's almost an oxymoron in that it's progressive medicine is almost an old school approach. So the things like diet, the exercise, like that, those are progressive things that doctors never talked about in the past. But with our patients, that is the emphasis. And it's funny that it's progressive because, again, it's so old school. But it's really those things. There's that anchor of the exercise, the nutrition, the sleep, the good, healthy relationships, social interactions, right? That's a big piece. And then a little more progressive therapeutics in the cannabinoids, in psychedelics. And even those, even though, again, the term progressive, rather old school as well. Of course, they've been around longer than you and I have. But that's where it is. And utilizing cannabinoids, again, for pain or sleep to get you back to where you can exercise again. Like we've had folks that because of their pain, they're really limited in their mobility, developed prediabetes or diabetes. And once the pain got better, once they started sleeping, medications got reduced. So that's a really cool part. And on my little podcast where we interview the patients, that was the one we're clipping up right now is a lady who literally came off her insulin once her pain and everything got better and she was able to move around. So that's it too. And then the psychedelic piece, we can't prescribe them yet. You can through a special access scheme, but again, to the Canadian system being flawed, if I want to help someone with end-of-life distress use psilocybin mushrooms, it's about an 8-month wait for the paperwork, and the patient's terminal and the system is just, it's terrible. So our hands are tied right now for physicians to utilize some of those things. But once the framework comes in place, you'll see things like psilocybin, MDMA be used for a number of mental health conditions. But where the evidence is PTSD and refractory depression at the moment.
Yeah, that I find very interesting, is that we're going down that path, which it's kind of funny in a way, because a lot of the critics of cannabis were like, well, then they'll make everything else legal. And my argument to that has always been, well, it probably should be legal.
Yeah.
Like it's kind of nuts that we're like, no, you can't have this plant, but this other plant is cool. You can have that one. It's always been kind of a silly way to think.
Yeah.
But
Like caffeine's okay, but this isn't. And this plant, no, but yes. And it is silly. But it's interesting times. When it comes to the psychedelics, the interesting thing there is cannabis kind of opened the door, if you will, and psychedelics will actually have a much easier time becoming mainstream with physicians because there is a body of evidence. The research has been going on for years, but for very specific indications. So cannabis, it's everything to everybody, and it was almost unbelievable, even though it does have a lot of benefits for sleep, pain, seizure disorders, right? But where psychedelics is going to be much more accepted amongst the medical community, it's a very narrow lens: end of life distress, refractory depression, PTSD, like this is the lane, and it will have a much easier time in the medical community.
do you think we're going to get to a point where in Canada, where we've completely decriminalized drugs? Do you think that's sort of what's around the corner? Maybe not around the corner, but like down the road somewhere?
I think that's where we're heading. Yeah. You see that in Portugal, they were the ones who took the lead on that, and that experiment has gone just fine over there. There's certainly calls for action in the States and here in Canada, and there's like initial steps. But yeah, I do think that's going to be the case. And then I think we really need to then emphasize the treatment for the people who are abusing those drugs, like really the investment in the treatment programs. Like if they're going to supply them to these folks, then they need that support network with proper counseling and ways to get them off of them eventually.
Yeah. And I'm assuming you see that, like, based on the Portugal experiment. I've read quite a bit about it. You see that as like that would be a net benefit to society if we did do that?
I think so. I think like the war on drugs is over. I think it's time for more of a nuanced conversation, and who knows what it's going to look like. But I think some next steps going in that direction will ultimately be a positive.
Yeah. Drugs won. Congratulations, drugs.
Yeah.
You took it. Yeah. I tend to agree with that too. I think the thing that people really get confused by when you talk about, drug legalization is they're like, oh, what's next? Like crime's going to be legal? Because they think about somebody who becomes a drug addict and they commit a violent crime. Like I mentioned, the armored car robbery. They think that because drugs are legalized, that all of a sudden armed robbery is going to be legalized. And they're conflating the two things. They're completely different. But the drug component of that, the drug addiction component, that is something that, you look at all the mental health treatment, that should really be treated as a, part of mental health crisis, I think, at least.
Absolutely, because I mean, it's extremely rare to see someone who is abusing drugs or addicted to any substance, whether it's drugs, gambling, cocaine, caffeine, whatever. But it's exceedingly rare that they don't have some type of prior trauma, some type of underlying mental health condition. Oftentimes they're using whatever the thing is to escape that pain or to escape that memory, or so they're undoubtedly tied together. And it's through that lens that I think the most progress will be made.
Yeah. I remember when I was going through the whole thing in the hospital thinking to myself, like, I hope this doesn't get its hooks into me. And I kind of felt like it was when I was taking like hydromorphone and stuff like that. I was like, this, I could easily see how someone would just fall in love with easing their pain.
Mhm.
Like, it just seems like such an easy thing to just, oh, the pain's starting to go away. I love that. And just,
Yeah. And in that scenario, it starts as the pain from the surgery, but oftentimes the people who do get hooked, oh, the pain from those thoughts I was having were gone too. Like, sure, it was helping that pain from the surgery, but why they get hooked and stay on it when that pain's gone, they're still using it as that means to self-medicate whatever else it was helping with, and that's how you get into that long-term addiction cycle.
yeah. I want to kind of steelman the argument against cannabis, and it tends to be more of an old school line of thinking, but a lot of people will say they'll worry about the issue with kids and what it can alter their brains, stuff like that. That's always been a common narrative that you hear. Or people will say there's not enough data to support the usage, or not enough evidence that exists that supports using things like cannabis, psychedelics in a way to treat medical conditions. What would you say to something like that? I'm sure you've heard that argument before.
Yeah, definitely. So for the first one, it's the distinction between medical and recreational cannabis. And certainly for the kids, the brain's still developing. Nobody authorizes that for children to use, except if there is certain condition that requires it, like refractory epilepsy, severe autism. But that is a concern, the developing brains. So we don't usually recommend, and certainly don't want any kids smoking THC, using THC. So that's valid. And that is the distinction between medical versus recreational and dosing. But when it comes to adults and when it comes to medical diagnoses and the idea that there isn't enough evidence, because that is certainly, when I speak with other physicians, and I've educated over 1,000 now in Canada and Australia, Germany, it that's the one kind of common theme for folks who don't want to adopt it into practice is there isn't enough large randomized control trials. Therefore, I can't prescribe this. And it's a bit of a misnomer. And we talk about this with them. And that's where you can have an opinion, an informed opinion. That's more of a talking point to someone who it's easier to just not prescribe it and keep doing what you're doing. And I certainly can understand that with physicians because we're all overworked. It's busy. Writing a cannabis prescription takes a bit more time. So it's easy to be like, not enough evidence. But the truth is, it is a nuanced conversation. And when you look at all the case reports, case series, these are things that contribute to the body of evidence, observational studies, randomized control trials, real world evidence. Now we have these real world evidence trials where you're looking at using the product in real patients, like fast tracking some of the traditional models. So there's this large body of evidence that you can have an informed opinion on, rather than just kind of parrot or kind of that talking point. No, there's not enough evidence. There certainly is to have an informed opinion, and that's what we try to stress, along with the understanding that you couldn't do the research because it was restricted and no one would fund it. So when someone says, yeah, but that trial is only 50 or 100 patients, they have to understand the why behind it. So long-winded way of saying there's certainly that element out there of there not being enough perceived evidence, but certainly there is, and you just have to take the time to review the whole body.
Yeah, it makes sense. It's like any debate. There's a lot more nuance to it than people will kind of, depending on what side they're on, they'll kind of only throw their talking points versus having sort of a discussion that's in the gray area of it. So yeah, I think that's good. So one thing that you've mentioned a few times here, and I see it all over your website, is talking about pain management. I feel like I don't know, maybe because I've been in chronic pain for over 6 years, I'm just like, there's got to be an epidemic out there of people of chronic pain. Because anytime I mention it, people are like, oh yeah, I've had this thing for years. and it seems like everybody's got something. Is that your experience too, that you feel like there's kind of an undiscussed chronic pain epidemic that exists in Canada?
Yeah, I'd say that's accurate. I would say it's a very common condition in primary care, and even more reason for docs to get comfortable with alternatives. And that means not just cannabinoid based medicines, but cognitive behavioral therapy for chronic pain, other modalities like even meditation and things of that nature, mindfulness, dietary changes. You said, Josh, that that lower inflammatory diet had been helpful for you. And so it's chronic pain is a big part of primary care, and that's where having multiple different options is certainly beneficial. I would say in addition to chronic pain epidemic, there's almost two epidemics and they're related. And this now makes up, honestly, probably about 60 to 70% of a primary care physician's day these days. And that's the combination of chronic pain and mental health disorders. And that really in a physician's day is taking up a lot of the clinical visits. And that's where robust, holistic care for both of those things, chronic pain and mental health, is certainly needed.
You probably can't put a number on this, but in terms of chronic pain, how much of it would you say you would attribute to just lifestyle? So we keep talking about diet and exercise, but like if you had to ballpark it percentage wise, how much of it do you think would be based on those things?
It's a good question. I would say, without a number, it's a good. There is a major component of that: lifestyle, sleep, exercise, nutrition, that is impacting those chronic pain diagnoses. Now, if someone gets hit by a car or something and there's a direct cause, right?
Yeah.
Sure, we're not going to say, hey, Josh, you should have ate some kale and you would have avoided that car accident.
I do love kale, but it hasn't helped the car accident thing.
It is delicious. Saute it. It's great.
Yeah, it's fantastic.
But it's more on the degenerative side. So things like osteoarthritis, things like diabetes, things of that nature, obesity. When you put more strain on the joints, there's going to be more pain. When you develop diabetes and then you develop the neuropathy or peripheral neuropathy symptoms, there's going to be pain. And it's because way back when the lifestyle caused it. So hard to say on a number, but certainly, probably, my opinion, those chronic diseases are so prevalent, diabetes, high blood pressure, obesity, that I don't think 50% would be out of the ballpark, where if you could kind of adjust that lifestyle, you could reduce your pain as a result or avoid the condition that led to those pain symptoms.
Yeah, makes sense.
I wonder too if kind of the change in people's, like you were talking about lifestyle, but change in people's careers. We're not working out as often. We're sitting at desks working, a lot of working from home remotely now. I wonder if that also attributes to some of these chronic pain issues.
Yeah. Yep. Absolutely. The more we're not in motion, the more chance that's going to happen. Pandemic, again, did not help the cause, but the good news is it is reversible. It can be changed. But so what we do for people who want to get back into that is first try and, of course, manage the pain symptoms. But then we have a real low and slow approach with resuming activity. And it's not because we don't want to overdo it on the patient. It's more on the habit side, establishing a new habit. And that is where tiny habits, whether it's the BJ Fogg book, Tiny Habits, or it's that Atomic Habits, but the messaging is the same. And it's, let's say it's someone for walking. First week, walk 1 minute, but every day at the same time. And people will be like, 1 minute, that's nothing. But it's literally the act of same time, being consistent, anchoring it to after my coffee, I will go for my walk. And then you do that for a week, then okay, 5 minutes, 10. But that's what we do as a way to kickstart people into those good habits, is really starting tiny and having some wins early.
I remember years ago talking with a friend of mine, and he was talking about like so it's kind of funny. He was sitting at his computer playing poker online, also smoking a cigarette, drinking, and he was rolling a joint at the same time. So he's doing all these things. Yeah. I was like, dude, how do you afford like all these vices? He's like, yeah, man, something has to give. But what he said, he's like, it's so easy to form bad habits. And I remember him saying that. I was like, is it really all that hard to form good habits? Like, habits are easy to form, but I feel like good or bad habits are easy to form. Like, if you just get into the routine of something, it doesn't matter if it's good or bad. I feel like once you've done it for a couple weeks, like it just becomes, like you say, a habit.
Yeah, exactly. Whether it's good or bad, the rules of the habit formation are the same. So make it obvious, time, date. The second one is like, make it attractive. So I make it somehow compelling, or stack it to something you want to do after. But the rules are the same, whether it's a good habit or a bad habit.
Yeah, it's just there's some mental block about forming good habits. I have it too. Like, it's always hard to start a really good habit. It's I don't know why that is.
Same here.
Because you're lazy.
Yeah, I am.
Yeah. Question for you, Blake. What would you consider to be your second story?
My second story is evolving almost every year, I would say. I think the most obvious second story would be the big switch from family medicine to cannabinoid medicine. Going out on that limb, no guarantees of patience or success, but just really trusting in what I was seeing clinically to take it on to my own. But yeah, that would be kind of the second story at the moment, but it evolves, like starting the agency where we're helping some of these companies with their marketing strategies and doing the education to physicians and research. That I never thought I'd be doing dementia research, for instance. So that's become a bit of a second story where I'm doing more research. And to be honest, you guys, it's even this past year, there's been transition on how I'm running the practice and the direction, taking it with more holistic things, into the exercise and sleep, and even talking to people about habit formation. So perhaps there's a few second stories, and that's kind of how I like it. And hopefully in the future, maybe some more.
Yeah, we'll have you on again, eh?
Yeah. Well, you could tell your second story.
Trying to position to people to watch this particular podcast with you, what would you say they're going to take from it?
I would say they're going to take from it a good chat with a couple good guys talking about all things important to health: exercise, nutrition, right? Proper sleep, proper social relations, how to use social media, all of the things, really. And even getting into, of course, what I do clinically, talking about cannabinoid-based medicines, and a nice little discussion on psychedelics as well.
Perfect. Well, thanks so much for coming on, man.